So you're all very, very welcome. My name is Luna Dolezal, and I'm based in the Centre for Cultures and Environments of Health here at the University of Exeter, which is where I'm standing right now. I am the PI of the Shame and Medicine project, and this talk is part of an ongoing seminar series we've had for quite a few years now, which looks at shame in medical history, and we've had talks from all sorts of people around lots of different topics, and it's really nice to have Emily speaking. Dr. Emily Cock is a senior lecturer in early modern history at the University of Cardiff, and her research is in medicine and around medicine and disability from 1600 to 1800. And I first met Emily quite a few years ago. We were just reminiscing about 10 years ago in Dublin when I was based there. And she came to speak at an event that I organized with Barry Lyons, a collaborator of mine, which was also about shame in medicine. So it's nice to circle back at this stage of our follow-on research project and have Emily here again. So I'm going to pass over to Emily. She'll tell you a little bit more about her research and then obviously deliver the talk. We have until 2:30. We might finish earlier. We'll see how long the discussion and questions go on, but we'll have a talk from Emily and then we'll have time for discussion and questions after. So take it away, Emily, and I'll be here if anything goes wrong or any issues. Just type in the chat if you're having any technical issues. Thank you.
Thank you. Just to clarify, it's till 3:30, but if you do need to rush off, I've just put an access copy of the talk.
Did I say 2:30? 3:30.
Oh no, I've written much too long a speech.
2 to 3:30. Just clear that up right away. Thank you.
But yes, if you do need to either read along or if you do need to duck out, I've put a link to an access copy of the talk in the chat, which you're more than welcome to have a look at. Thank you very much for the invitation to speak as part of this series. Obviously, I'm sad not to be having an excuse to go down to Exeter, but teaching. I'll speak a little bit sort of about my research as I kind of weave through the talk. But just for anyone who is listening to the speech rather than watching, I'm a white woman with brown hair, glasses, and wearing a blue shirt. I'm not going to have many images in this talk, but I will describe any that I do use. So today I'm going to be speaking about shame and health in the early modern household through a case study of gentry woman Gertrude Savile. In previous work, I've mainly looked at shame and medicine in relation to venereal diseases, so the pox and the clap. So I've appreciated this opportunity to sort of start thinking about how shame affected the experiences and care of less obviously stigmatized ailments too. I'm going to address three main areas of Gertrude's experience of shame today. The first is in relation to her experience of facial disfigurement as a young woman. The actual ailment seems to have caused her probably more embarrassment than shame, but her chronicling of it certainly suggests some shame, perhaps much later, about her resulting behaviour in this period and what she saw as a detrimental effect on her character. Second, I will consider shame within some of her encounters with professional medical practitioners, especially the Sergeant Surgeon Caesar Hawkins, to whom she turned for help with chronic piles that had progressed to an anal fistula. And finally, I will expand this to the wider circle of carers upon whom Gertrude was reliant, servants and unlicensed practitioners, to get a better sense of the place of shame in everyday household healthcare practices. Domestic service was a complicated business, and the acceptable emotional regimes between the mistress and the household were further tested by periods of ill health and incapacity. As a spinster at the lower end of the gentry with good but not extraordinary financial means, Gertrude makes more visible than usual some of the insecurities of household management, and especially for the final years of her life, her own shame at how ill health exacerbated and exposed her insufficiencies in her managerial role. So, who is this woman? Gertrude was born at Thornhill in Yorkshire in January 1697 and died in London in March 1758. Her father died when she was 3, and her brother, George, inherited a surprise baronetcy and properties, Thornhill in Yorkshire and the main estate of Rufford in Nottinghamshire. Gertrude never married, and her financial and social position were therefore a bit unstable, being initially reliant on an allowance from her brother, George. For the first few decades of her life, she shared a very tense household with her mother, Barbara, until, in a surprise twist we all dream of, a merchant cousin living in Calcutta, Jonathan Newton, left her enough money and property for her to establish her own household at Farnsfield, near Rufford, going into her 40s. She lived in London thereafter, but visited Bath several times for health reasons, making her in many ways typical of what you would expect for an 18th century lower gentry woman with a range of health conditions. Now, Gertrude is interesting to me for many reasons, but a key one is that she had the good manners to leave a nice little body of life writing, which I'm working on publishing in the near-ish future as a new edition, and these are my sources today. They include diaries, letters, poems, a commonplace book of extracts from her reading, and account books that give excellent details about her income and expenditure. Savile started the accounts following her inheritance, and 2 books cover March 1736 to 1758. Her diaries actually survived from 1721, so aged 24, until a final unfinished entry on 28th of December 1757, a few months before her death. The manuscript suggests that she started it earlier. There's some big gaps. We assume from context that those volumes are missing, that they did exist at some point. The diaries that do exist aren't exactly complete because Savile, especially when younger, was her own most severe editor, as you can see here, where the manuscript is extensively scribbled over. Now, I mentioned that she never married, but that doesn't mean that she didn't have some crushes on men who were either too high-ranking or too married to be credible suitors. And obviously, it's impossible to say for sure, but from context, my guess is that many of these passages and their erasure relate to embarrassment about those infatuations. But that's shame for another day. Between these account books and the diaries, I can get a pretty good glimpse into Gertrude's perspective on and management of her world. But one of the key functions for her was emotional outlet. Gertrude mentions reading passages of her diary aloud to family on a couple of occasions, but in general, these are very clearly supposed to be private documents. In addition to the highly scribbled over passages, she sometimes writes comments backwards as a basic form of code. Over the course of her life, Gertrude turned to the diary to pour out her anxieties, frustrations, and sadness. There are long passages of self-recrimination and complaint, many of which were edited out entirely or highly abridged from the 1997 edition of the diaries produced by Alan Savile and Marjorie Penn from 1960s transcripts by Dorothy Hooper. Going back to the manuscripts is therefore the only way to get this fuller picture, and is the impetus of my new edition plans. But even the account books can sneak in these details, as expenses are described with occasional remarks about how she feels about the purchase. While much of the castigation in these texts is against herself, they are also venues in which Gertrude upbraids other people. She's keenly interested in politics and freely casts her judgment on Britain's politicians and aristocracy, as well as their foreign enemies and allies. Where she feels shame in interactions in person, she is able to use these textual spaces to sort of talk back. And I would argue this is nowhere more evident than in her account of treatment by Hawkins. Now, it's perhaps worth saying early on that Gertrude is often very unlikable. Alan Savile justified a lot of his cuts by saying that her writing is often tedious and repetitive. Amanda Vickery, in her study of 18th century domesticity, describes her as, quote, a depressive spinster, a resentful dependent, excruciatingly shy, gauche and sour, who found almost her only relief in needlework. On this, I rather like Bridget Long's emphasis on the sort of haptic relief that the constant stabbing motion of the needle might have provided her when she was fighting with her mother. She would have later conflicts with nieces and nephews, as well as the servants and doctors in this paper, though I'm pleased to report she got along well with her nephew, Sir George. And the diary is an outlet for her own reflections on these conflicts, and I think shame is very present, not only around her position as an unmarried dependent, but also around how she then feels about this position and behaves around other people. It's a bigger part of her 20s, with passages in her code complaining about my trembling, faltering silences, my choosing to sit alone rather than endure the agony of going into company, and the insolency that my insignificant, despicable figure exposes me to from my brother's servants. Fred Cooper actually spoke in his paper in this series, now on YouTube, about loneliness as a shame-inducing emotion in the contemporary world. And going forward, I do want to think a little further about sort of the history of emotions and what that can tell us about Gertrude's melancholy and potential shame around it. Now, since I appreciate that it's probably a bit of a mixed crowd here today, I'd like to very quickly put forward two key points about the historiography of early modern medicine that are underlying this paper. So patient voice and the medical marketplace. Now, for the last 50 years, it's not a new thing, historians have challenged the doctor-focused perspectives of medical history in order to understand what healthcare recipients felt about those interactions, how they made choices, and what effects this had on medical practice and development. Rather than mere bodies being treated, it was a turn towards seriously considering the agency or voice of the sufferer, and that, in Roy Porter's foundational article on the subject from way back in 1985, it takes two to make a medical encounter. Indeed, it often takes many more than two, because medical events have frequently been complex social rituals involving family and community as well as sufferers and physicians. As he also points out, for the early modern period, professional practitioners were also quite marginal players, recruited only in extreme cases, as most day-to-day health was dealt with through self-help, family, or community care. Many historians have therefore argued that early modern British medicine did not operate with isolated professional physicians, surgeons, and apothecaries monopolising medicine and neatly dividing roles between them, but was instead a busy medical marketplace where university-trained physicians competed with a huge range of unlicensed practitioners. As I've argued elsewhere, practitioners negotiated shame within this to attract and control customers, berating people for not coming sooner or promising to treat stigmatizing ailments like the pox with discretion. Gertrude takes full advantage of the range of options available to her, and these increase once she controls her own money. She consults with several surgeons and physicians and frequently buys medicaments and advice from apothecaries. But she also turns to unlicensed practitioners, the kinds of people that have historically been classed as quacks, advertising in the newspaper or by word of mouth. I'm obviously focusing on medical details for this series, but once she is really ill, the whole household is rearranged around her. So more broadly, I'm also thinking historically about insights that disability studies scholars have brought to understanding care work and the reconfiguration of home and workplace structures and relationships. And I'm sort of thinking this through as the sufferer-centred household, because it is not only medical care in changing bandages and administering ointments. It is a household that is temporarily, although in this case it lasts a long time, entirely organised around the needs and desires of a person who is ill or incapacitated. But, of course, we need to think carefully about the period details. For this gentry spinster's London home, it is an entire reconfiguration of roles and identity among the servants. What does the coachman do if she's never using the coach? Who is coming to visit, and how, and where, and by whom are these visits being managed? Who is maintaining oversight? And if it is still Gertrude, what sort of tweaks in the system might be needed to enable her to retain that power and avoid shameful dependence on social inferiors? And how does all of this affect the honour of the household and all of the parties within it, in a period where honour carried serious social and economic implications? All food for further thought. It's appropriate to begin properly by introducing you to Gertrude's face. Unfortunately, there is no known portrait, although I do know that she had one painted, which she's very embarrassed about, so you sort of see a running theme there. But I learned of Gertrude Savile through Amy M. Freud's study of unmarried early modern women, where she introduces her as, quote, an example of a single woman whose physical appearance played a role in her not marrying, but not necessarily in the way we might think. In her 20s, Gertrude experienced some kind of distemper or malady, those are her words, in her face, affecting her appearance, which she blames for her acute shyness and inability to go out as freely as she would wish, and having to seek lots of medical attention. In 1722, for example, she says that I was very much a prisoner all this time from my face, indeed never fit to be seen abroad. Now, this turns out to be a little hyperbolic, but when she does go out, it is in conditions where she wants to be less visible. She says, I was unable to bear home always, therefore sometimes I went out to several plays in the gallery, to 2 or 3 operas, visits sometimes to Hyde and St James's Park. So we can see her sort of emphasis on sitting in the gallery as a less conspicuous seating area. Facial disfigurement could be disabling to different people in different ways. This has been a big research area of mine. And for early modern women, as Michelle Webb has shown, it could seriously affect the sense of self. Gertrude certainly considers it a shaping factor of her youth, and moreover is illustrative in showing that the shaming impact was both more than medical and long-lasting. In 1727, she reflects, I have thought the great occasion of my more than common dispiritedness was from the distemper in my face, and I believe it has been so, and has broke my spirit. Such a continual mortification, all my youth and gay part of life, not only cut me off from all the advantages and pleasures of it, but has cowed and depressed me beyond recovery at this time of day. When, though thank God it is in a great measure removed, which I was fool enough to think would alone make me happy, I find it too late to taste the pleasure of it, and have got too great a bent of dullness, and am too much diseased to the world to enter now or join in the satisfactory of it. So now 30, she is convinced that this experience of embodiment has had too great an impact on her character, ruining her chances of marriage and rendering her unfit for company and the world's pleasures. Now, this lack of marriage wasn't actually so uncommon. Freud estimates about 20% of people didn't marry. But for Gertrude, it is a source of shame in her 20s and 30s that poisons her interactions with her family. Now, there are many examples I could give here, but let's just take a moment where this intersects with household health. Gertrude castigates herself for how she responds to these slights, expressing shame at dishonouring her mother, and attributes medical misfortune to the physiological effects of this emotion. So in October 1729, Lady Castlemaine invited herself to dinner the next day. Unfortunately, this was a few weeks in which the entire household was ill with something feverish. At one point, Gertrude describes their illnesses as colds, and later that her mother's has grown asthmatical, so it's maybe a flu. It's speculation. But she says, my mother was taken very ill, and Nanny, that is a maid, in short, all the servants. It seems there is a universal illness over the whole town. I was forced, though ill myself, not to consider it, and to be with mother and Nanny. There were none well in the house to attend the sick, a calamitous condition. So here Gertrude takes on a nursing role, and it must be said, rather congratulate herself for her effort. Anyway, Barbara sent Lady C a note that she was not well and could not see her. So this episode is illustrative of the disruptive impact of ill health on the entire household's role in meeting expectations of polite sociability, and through this, maintaining the honour of the family. But Lady Castlemaine said she would just pop in anyway. So Barbara, of course, had to invite her to dinner after all. And Gertrude reports all the sick servants, for there are none quite well, were put into a hurry, and all other preparations were made, only to have Castlemaine send a note at the 11th hour that she just couldn't come in. And Gertrude probably legitimately assumes this is a deliberate slight out of resentment for being refused before. So she's also trying to save face here. But in all the to-do in this, family dinner doesn't actually happen. Gertrude waits in her room for it from 2 till 5, then gets herself some bread and butter, and she says, "I was so great a baby, for shame I well deserve to be whipped, to cry for my dinner. Indeed, I was not well, my spirits sunk to the lowest ebb, faint and fretful, and thought myself too much neglected, and was quite vapid. I set it down for my shame." Now, this line certainly captures one of the functions of the diary in her view, a sort of confessional space, not only to provide emotional relief, but in fact to record shameful behaviour so that she might learn from it. Now, unfortunately, this lesson does not come quickly, as 2 days later, Gertrude records, "A dreadful day, the worst, I hope, of my past life. Oh, that it may please the merciful pardoning God to keep me forever from the like again." Her mother, Barbara, is still ill, so everything is happening in her bedroom, including eating lunch with a friend. Gertrude describes Barbara saying many vexing, galling things that, she allows to pass. But upon her saying something I took to be a ridicule and reproach for my not being married, which is indeed prodigiously unkind and particularly unjust in her, I never gave her cause. I say, upon that too violent a provocation, I gave the reins to my brutish, terrible passions. I must not repeat. I am ashamed to remember how far my madness went, what rash, what dreadful things I said. Now, there is now a lengthy passage of self-recrimination and guilt. And she goes on her knees, she says literally, the next day to beg her mother's forgiveness. And there is a reconciliation. Part of Gertrude's guilt manifests in her taking on further nursing duties and sending for physician John Hollings, which mother did not quite consent to nor forbid. But one of the most striking points of shame and medicine in this section is that after the outburst, Gertrude goes to the barnio. This is regular behaviour for her. She goes to be sweated and or to be cupped, so that is bled, and these kinds of evacuations continue to be widespread practices. She reports, however, that in the agitation and disorder I had put myself in, I believe it was hurtful. I was cupped and very faint and ill. Now, while humoral medicine's close link between the passions and health was, waning, we see here continued belief in the impact of emotional stability on corporal health, which, interestingly, Michael Brown actually spoke about continuing into the 19th century surgery in his presentation in this series. So more homework for you there. Having introduced you to the unhappy, shame-filled Gertrude of her 20s, I would like to jump ahead a little to her post-inheritance 40s and 50s. I don't think it will shock you to hear that she is a little calmer with control of her own household. But there is a deep vulnerability and sense of instability that does continue. And shame features as a weapon on both sides in encounters with many medical practitioners. On December the 2nd, 1756, she records a payment to the King's surgeon, the top surgeon in the country, Caesar Hawkins, later Sir Caesar. Gertrude was thoroughly unimpressed by him. She writes this payment as, "Gave Hawkins the surgeon £4 4s for coming to me 3 times, though he did nothing but once looked upon a gathering I had, nor would answer any question useful just about that." Some long passages covering November, January in the diary give us some more insight into this patient-practitioner interaction and where shame might have played a role. Gertrude was suffering enormously during this period. She describes herself as long out of order, 2 months or more, had several complaints, my head and stomach sick after eating, constant looseness, so probably diarrhea, sleepiness and piles, was blooded and vomited, those are treatments, but without any relief. The man who bled me said he never saw so bad blood but in a pleurisy. Now, this man is just the first of several different practitioners for whom she uses this space in her diary to cast judgment. And in this, we can clearly see her assessments of practitioners' emotional management factoring into decisions about her treatment, as well as her thoughts about their efficacy. And just for clarification, it is very normal that these practitioners are coming to visit her at home. That's quite standard. Now, the first is, quote, young, careless Mr. Mandeville, whom Gertrude accuses of poisoning her with a dose of physic that much aggravated her illness. This apothecary had actually been treating her for 2 years, but she says that after his treatment, she grew worse and worse, particularly as to the piles, for which had ointments and leeches 3 times, which grew so bad I could neither lie, sit, or stand, but with great misery, little sleep, no stomach, constant and increasing pain. During this period, she paid for a nurse to sit up with her, and the account book shows that besides the £1 4s fee, Gertrude is keeping the nurse happy by buying her tea, rum, porter, sugar candy, and chocolate. But she's not happy with the woman. Though I believe she's one of the best of those sorts of people, as she was neither a drunkard nor saucy, bad is the best of them, she being much more troublesome than useful to me, glad to be rid of her in the midst and worst of my illness. And her complaint here reveals 2 of her key dislikes in servants, drunkenness and sauciness, which I'll return to in a moment. Desperate to avoid surgery, Gertrude persists with other recommendations from an apothecary in the street, Mr. Ofty. A bit of searching in contemporary newspapers indicates this was Godfrey Ofty, based in Great Russell Street. In writing up this account of her illness later, Gertrude describes herself as having fooled on with him a long time. The term fooled perhaps suggesting a sort of self-chastisement over the reluctance and terror, as she describes, of actually consulting a surgeon and sort of sticking with these other practitioners for too long. She at last chooses to consult Hawkins based on the great commendations some years ago of 2 female friends. Here he is in a portrait by William Hogarth, respectively suited and bewigged. Hawkins had been surgeon to King George II since 1747, for whom piles had been a problem for many years. In 1746, Gertrude even records in her diary that celebrations for the king's birthday had to be delayed because the king was so ill of the piles that he could not travel from Kensington. Knowing this experience probably influenced her decision to consult Hawkins, but it's not what she records in the diary. Instead, she asserts that she had been guided by her friend's commendations, particularly of his humanity. Thus, we see her insistence, at least retrospectively, that it was his favourable bedside manner that she was looking forward to. Her stress on this may, however, be influenced by their eventual interaction and the resulting portrait that she wanted to create in her diary. Immediately after this compliment, she notes in parenthesis, "How little does he seem to me to deserve the character," and describes him as the dreadful Surgeon Hawkins. His arrival was not auspicious. The piles had been gathering into a large hard lump for about a month, which gave me exquisite pain, and they burst the day he called. This is the occasion on which he examined or looked upon her, though she says that he pronounced nothing, said there was danger of a fistula, which of all things I have always had the most dreadful apprehensions of. On his second visit, she, quote, paid him off, being too much shocked with his looks and manner, and though he neither did or prescribed anything for me. Now, though Gertrude would hardly call an elite male practitioner saucy, the portrait she paints of Hawkins' behaviour hints at a similar lack of deference and concessions to her emotions, in her view. Whether he makes her feel ashamed or she considers his shocking looks and manner shameless is sort of open to interpretation. Now, she doesn't talk about herself in this passage. The failure of the medical encounter is placed entirely on Hawkins' shoulders. Having been attracted by his reputation for humanity, Gertrude feels herself brusquely treated as a medical case rather than a full human, which in her case must be one due certain regard on account of gender and gentry positions. It's in the third interaction that Gertrude uses shame to have her revenge on Hawkins. After noting that she paid him off on the second visit, she adds briefly that she was glad to dismiss him with 4 guineas, for which he mighty generously called once more at my door, but did not see him. Let's unpack that final visit just a little. Gertrude's sarcastic mighty generously underscores her view that nothing Hawkins did was actually worth his very stiff fee. But it's the statement that she did not see him when he came to her door that stings. In other words, Hawkins has made a house call and had a servant open the door. The servant has then gone upstairs to tell Gertrude that the surgeon is here, and she has refused to admit him. Goodness knows what reason she gave, as unlike with Lady Castlemaine, you can't really claim illness for refusing to see the doctor. But the servant will then have had to return downstairs to tell Hawkins that he should leave. In how many words, we'll never know. And whether Hawkins really felt any shame at being thus rejected by his patient is frankly impossible to assess from these sources. Nor have I yet found any relevant documents from him that might help illuminate the matter. Any recommendations of archives for him will be very much appreciated. Maybe he was delighted to be free of this particular patient. His career certainly didn't suffer. I like to think that Gertrude, watched him from her window trudging away in his wig, but that's pure fantasy on my part. What we do know is that she refused an elite surgeon access to her body because he did not meet her expectations of how he would address her and answer her questions. She did not give in to any sense of obligation or embarrassment by agreeing to see him when he came to her home again. In this, Gertrude was expressing what little power was available to her in this painful situation, and giving us a little more insight into patient-doctor interaction and conflict in this period. Having been so unimpressed by Hawkins, Gertrude turned to a very different type of medical practitioner, an unlicensed woman named Mrs. Payne. Yes, really. Whom she refers to in the account book as my surgeoness, and in the diary as a famous woman in the neighbourhood. Mrs. Payne attends her over 3 weeks for the bargain price of 10 shillings and 6pence, which underscores the high price of Hawkins. Payne also hinted that it was a fistula, but Gertrude resisted this diagnosis for as long as she could, until, quite tired out with painful uncertainty, was once more persuaded to have another surgeon, Mr. Sharp, another great name. Gertrude says she's actually able to accept Sharp's diagnosis, in large part because his demeanour is extremely different indeed from terrible Hawkins, mild and soothing, in appearance compassionate. And she goes on to say that the appearance of that alone is sometimes, nay, considerable alleviation. Pretty poor, miserable patients may not have that comfort, and instead of it have their terror increased by rough, butcherly behaviour. So again, the suggestion that Hawkins had been rough and butcherly reiterates the lack of delicacy that she detested and gives herself the pleasure of upbraiding him in private. Sharp agrees that it is a fistula, and that though 'twas incurable, as I knew before, without cutting, 'twould not kill, that I might live with it many years, nay more. Though Gertrude still rejects his encouragement to undertake an operation, she takes this certainty as a turning point, framing her rejection of the operation not just as a decision born of fear, but also of cheerful resignation to God's providence and his use of pain to amplify contrasting experiences of ease and health. Thus, she asserts, I am persuaded that I am a great deal happier for this illness, notwithstanding its continuing and wilful life to be very troublesome and changeable, often very uneasy and painful, always extreme mortifying, and in some circumstances, shocking. Here we do see the particularities of this anal ailment as a cause of shame. Not only is it painful, but the necessity of having constant attention to her private parts also makes it always extreme mortifying and indeed shocking. Now, without undercutting any genuine pious reflections that Gertrude may have experienced in this long period of keeping my room and almost my bed, as she says, it is worth recalling the extent to which Gertrude uses this diary to reflect her own behaviour back to herself. Where in earlier episodes that I've quoted today, she, upbraids herself for shameful behaviour, this is perhaps an occasion where she is congratulating herself for a resignation to God's will that is characteristic of early modern ideals of piety. Now, these outside medical practitioners are continually overlapping with the care provided by Gertrude's live-in domestic servants. Historians from Anne Sturm-Kussmaul, through Tim Meldrum, Bernard Kapp, and most recently Charmian Mansell, have illuminated the highly complex and often fraught relationships between early modern householders and the range of people who might be classified as their servants. Now, Gertrude tends to have 3 or 4 living in the house and pays a huge range of people for other ad hoc tasks. And this level means that she's always the one that is managing the household overall. Gertrude had always struggled with servants. We saw that in the quote about her brother's servants. And when she was a dependent sharing a household with her mother, she saw the undercutting of her position in front of servants as particularly humiliating. Her complaints about servants are often about their lack of shame. But in many cases, and this is where historical context really has to be borne in mind in order to have any sympathy for her, this shamelessness in servants amounts to their daring to allow their presence to be felt, and especially Gertrude's absolute dependence on them, to be clear. We have already seen that a servant would have been required to dismiss Hawkins, and Gertrude's silence on that point actually suggests it went quite smoothly. Don't know how the servant felt. Confined to her room, she must have entrusted the household keys to a maid, who would also have been dealing with most of the outside labourers. In the final entries of the account books, there are books being purchased for her, so she may have been relying on others to actually go to the bookstore and make those decisions for her. Gertrude does have a high turnover of staff, but this wasn't entirely unusual. Tracing servants between 1695 and 1725, Peter Earle found that 62% moved posts within a year for a wide variety of reasons. Now, I don't as yet have any written records from Gertrude's servants themselves, and frankly, I'm quite unlikely to find them. So I'm trying to work critically with Gertrude's accounts to get some sense of what the staff were thinking about their positions and how the needs of the sufferer-centred household interacted with their own senses of shame and honour. Gertrude sometimes hires extra staff to cover jobs while servants are ill, and she pays for their medication. But this is not without expectations of gratitude. She records paying 10 shillings for the apothecary's bill for unworthy grace. And we soon after see Grace Long's dismissal. Obviously, her shameful behaviour had included insufficient performance of gratitude. But Gertrude's footmen, in particular, seem quite keen to escape the inactive female household, and she is convinced that their bad-mouthing of her management impedes successful replacement. Gertrude is obviously far from an impartial source here, but she is plagued by their drinking, insubordination, and lax performance, and every firing sees additional payments in lieu of notice, costs to advertise for a replacement, and adjustments to the livery. In an early example, when she's still living with Barbara, a servant named William starts misbehaving after an old friend of his arrives next door as a coachman to the physician Charles Jerningham. After formal warnings and recruiting his sister to give him a talking to, which was probably also quite humiliating for him, Gertrude confronts the tipsy William. She says, "I spoke in a manner he was not used to from me, called him a rascal, and said he should lie in this house no more. He did not ask pardon, nor desire to stay, sometimes cried a little, sometimes smiled in my face." Now, it's difficult to guess the cause of his tears. Anger, shame, fear. But Gertrude's emphasis that he smiled in my face shows that she was expecting some kind of performance of contrition. Her reflection captures a sense of betrayal. From having been a good and even favourite servant, he has grown so exceeding bad, in all kinds sullen, saucy, the reverse of what he was at first. He is so hardened, past shame or remorse, that it is impossible to keep him. Faced with a reminder of her vulnerability to these people, and perhaps even shame about her failure to manage these relationships better, Gertrude uses her diary to lash out at him as he departs. The period of Gertrude's anal fistula, when she required a lot of hands-on care, was especially difficult and affected the skills and tasks that Gertrude demanded from her household staff. One of the clearest actions that comes across is servants' resignations, which Gertrude doesn't tend to take well. On February 12, 1757, the cookmaid, Sarah, resigned. And Gertrude says that she'd always disliked Sarah's cooking and also her Welsh obstinacy, and would have fired her earlier, but for her sad illness. The account books show that Gertrude almost always gave servants wages in lieu of notice, preferring to lose out economically rather than have disgruntled staff hanging around. And she is able to replace Sarah with another cook, Elizabeth Jones, the same day. But a week later, her maid Mary Robinson resigned. As with William and Sarah, Gertrude moves into a long passage detailing the departing servant's faults. The predictability of this leads me towards seeing this as one way in which she sought to save face, even if only to herself, in attributing the breakdowns in these relationships to the servant's diverse faults rather than any of her own. Gertrude says Mary had no properties of a good or at all useful servant. Instead, what chiefly recommended her to me was, as she said, her having been used to sick and infirm mistresses and masters, some of whom died while she was with them. Having hired her because of this experience, Gertrude evidently saw Mary's key role as that of nurse, since she asserts that this was a pretense for her doing nothing else. But it is Mary's inability to manage a satisfactory emotional regime that Gertrude dwells on here. She describes her good nature as only of the rude and giddy sort, and that being only used to working for tradesfolk's families made her very vulgar and too familiar, and indeed neither to be fit for nor like anywhere. She was not quite hail fellow well met. This phrase suggests over-familiarity and undue intimacy, so the saucy maid appears again. Gertrude deliberately took on another maid with medical experience. Elizabeth Fraught, widow to a surgeon of Colchester, came as my own servant. She pays her a higher wage of £8 a year. But this was not to include medical tasks as standard, because she later pays Fraught an additional 5 shillings for bleeding her. So Fraught was hired for knowledge of medicine and patient management, but her key tasks were more general. Instead, Gertrude separated this intimate bodywork from the other tasks of a maidservant by choosing to have a woman instead of my new maid to come every day to do what was necessary for my sad complaint. Accordingly, agreed with a poorish woman, one Cherrington, to give her 3 shillings a week. So only slightly less than the £8 per annum. The framing here suggests that Gertrude had asked or demanded that Mary undertake some of the medical tasks required for her fistula, and this became a point of contention between them, since Gertrude says that she too gave me warning because of my illness. 'Twas base and unworthy and cruel in her. While doubling her wage costs, the clearer demarcation of medical tasks from more general maid work was one way Gertrude was trying to manage the individuals within her household. Cherrington is initially recorded in the accounts as Daily Woman, but is named after 3 months, perhaps reflecting Gertrude's acceptance of her as part of the household, even if she's not living in. She does, however, name her as Mrs. Cherrington against the maid's Christian names, giving her a sort of slightly elevated position, appropriate to her close proximity to Gertrude's most intimate experiences. Mrs. Cherrington never left, so Gertrude never has cause for one of her standard cathartic passages on her as a poor servant. But she doesn't even make a passing disgruntled remark, either in the diary or the account book. Mrs. Cherrington only appears in her wages and additional allowances for washing, so perhaps she was taking the dressings home to clean, and on 2 occasions for taking Gertrude's dogs home with her, maybe while they're in heat. And by contrasting these sort of quiet entries with that relating to the other servants, those huge passages, it seems evident that Mrs. Cherrington was able to maintain a level of distance and propriety that kept Gertrude comfortable. So in a household of fraught hierarchies, requiring or delivering treatment for embarrassing ailments like anal fistulas, or failing to meet social and economic obligations due to immobility, threatened your honour and position. As I've shown, Gertrude Savile's life writing gives a valuable insight into the impact of shifting health problems on household relationships and management. She considered her early experience of facial disfigurement as profoundly shaping her character, and found shame in her self-perceived shyness and melancholy. Her diary in particular provided a space throughout her life for her to remind herself of her shameful thoughts and behaviour, sometimes in the service of repentance and self-improvement. But it also gave her a private space in which to rebuke others and frame conflicts to her own satisfaction. Even once she moved away from youth and pressure to marry through the gaining of financial independence, shame played an important role in her interactions with a wide variety of individuals, including medical providers. These ranged from professional practitioners to the servants within her home, fully illustrating her engagement with a diverse medical marketplace. At the end of her life, she felt that her anal fistula must be very troublesome and changeable, often very uneasy and painful, always extreme mortifying, and in some circumstances, shocking. This mortification played an important role in how she experienced the ailment and the needs for care that it created, and the emotional performances that she expected from those carers. She expected paid practitioners to treat her with respect and attention, regardless of their social status, and would dismiss a king's surgeon as readily as a footman. These uses of shaming to manage these relationships, control behaviour, and shape medical interactions of diverse kinds will provide me with plenty to think about going forward, and I'm looking forward to hearing your questions and suggestions for that work. Thank you.
Thank you, Emily. I'm trying to look for the reactions so I can do those virtual clapping hands, but I can't seem to find them. Thanks for stopping sharing, and we've got plenty of time for questions. So I'll open up the floor. If anyone has a question, you can either type it in the chat and I'll keep my eye on the chat, or you can raise your virtual hand and ask in person if you like. So any comments or questions from the room? Hilda, go ahead.
Just turn on my video for a minute. I don't see it. Does it come up?
Yeah, we can see you.
Okay. Yes, I think I was expecting to hear a lot more about, the phenomenology of Gertrude's shame. And when I think about the actual conditions that she had, it seems to me that, well, even now in this period, if I had something like that, I'd be absolutely dying of shame and embarrassment. Now, I know there's a big difference between shame and embarrassment, but I don't think it came through quite the extent to which Gertrude's shame was influence all these interactions and relationships. Is there something more that you could bring out to show how you came to the conclusion that these were all manifestations of shame?
It's a good pressing question to kick the ball, get the ball rolling. I think one of the things that I'm trying to really kind of get to grips with is the particularities of that relationship of a household mistress in, you know, the mid 17th century, or sort of, sorry, 18th century, and the people that she is paying to work for her to provide sort of hands-on bodily care every day. And this was such a standard practice. They're sort of getting help with dressing. You're getting they're making your food. There's kind of a level of, I suppose it's kind of bodily attentions that I would find absolutely awful and humiliating and shameful to think that someone else is dressing me. But obviously she doesn't think like that, because for her, this is entirely what she is entitled to. So I think, and it's definitely something I think that's worth thinking more in terms of how it affects sort of her particular, once she's got the piles and the anal fistula, but she's got so many other kind of ailments that are also compounding this. And she's, you know, getting people to clean up her vomit on a regular basis, because that is one of the treatments that she's receiving when she has, you know, headaches or stomach aches or whatever it might be. So thank you. It is something I definitely want to kind of press further, because obviously I've only really got her kind of perspective on all of these things, but how I kind of think very carefully about the dynamics of those very historically specific relationships, and where these kind of slightly elevated interactions are kind of bringing in shame, where it kind of goes further, and where she thinks that it's gone wrong, and where all the shamelessness of the servants are kind of failing in these relationships. So that's just my way of saying, yes, it's something I'm sort of trying to think very carefully about, but I'll go back and see if I can find more.
On that point, there are some questions in the chat, but I'll just ask this because it follows on directly. I was thinking about Axel Honneth's writing about recognition, and he gives an example of how, like, the kind of invisibility of a slave to a master, and how we don't afford recognition to the slave because they're not fully human, and therefore in their eyes there is no shame and embarrassment to be in front of them, to be naked in front of them, because they're not, there's a kind of hierarchy, right, of shame is heavily tied to power and hierarchy. So the lower down a social hierarchy you are, the less potential there is for shame, for you to be able to make someone else feel shame. So the servant or the slave or the person who's not fully human in a dynamic has even less potential. And does that kind of map onto, I mean, where in a social hierarchy is a doctor or a apothecary relative to a lady of the gentry? You know what I mean?
It would be a bit of a spectrum, because there's sort of doctors and doctors. I think if she was, and this is actually quite, it's going back to Nicholas Jewson, quite kind of sort of actually very early work on sort of social history of medicine, and what kind of role kind of having to manage, you know, aristocratic health, and what you can sort of say to an aristocrat without having him kick you out and, you know, destroy your reputation, and all those different kind of levels. So one of the things I find interesting in Hawkins is he is kind of, yeah, top surgeon of the country at this point. So socially, I think he kind of would be a higher position, but of course he is also still someone who has to work for his living, so that kind of bumps him down the scale. But I'll chase you for the remind me of the name for the slavery things. I had forgotten about that. So I think the servants are definitely kind of higher, and particularly because Gertrude's always in a small enough household that she never sort of has a housekeeper who can kind of act as an intermediary between her and her servants. They are always kind of visible in that way because she's having to work out who's doing what, and she's always complaining about people not doing things. But she does compliment them sometimes. She's paying for them to, when they go away, she sort of pays for them to go see the local tourist attractions, or buys them books or things like that. So they're much more visible in that sense. So I think there is that capacity for shame in a way that there isn't in that master-slave relationship. But yeah.
I was muted, sorry. There's quite a few comments in the chat, or a couple of comments there. So Arthur has asked something interesting about finances and shame. So he says, there's something interesting in the use of finances to avoid shame, the additional payments paid to servants and doctors to avoid either having her name besmirched or engaging with them once the transactional relationship was over. Do you think there's a connection here with Gertrude's worries about her face? And to what extent does money in the period stand in or substitute for protections against shame?
Uses money to control relationships in interesting ways. So one of the things that I see very frequently in her account books is that she overpays people. And part of this is, classic sort of noblesse oblige, that of course you're going to pay slightly more. But she does kind of routinely do that with the medical practitioners, where there isn't quite the same expectation as, the chimney sweeps, you're sort of expected to, give them a little bit extra. And she certainly doesn't pay Hawkins sort of, or at least doesn't mention that she's paying more. She always makes a point in her account books where she sort of what the bill was and then paid more. And every once in a while, she will actually tell herself off in the account books for having paid more than she needed to. And she calls herself a fool, and so that there's a weird sort of, yeah. I think in Hawkins, she is definitely paying to get rid of him, and she definitely does that with the servants as well. It's just such a routine practice of hers. If she wants to get rid of someone or they choose to leave, then she will always pay their salaries rather than having them sort of stay around to serve out their notice. Even when that is creating problems for her, something she complains about all the time is, you have to replace a servant once you've got them. And there's new payments that sort of come into, or new costs that are involved in that. So, if it's a male servant, then you've got to pay for the livery to be adjusted, or you need to get new livery. You need advertising, all those things. So there's definitely kind of interesting things with money and sort of the expenses that she's willing to pay to kind of save herself, both trouble and sort of, shame, save face. We sort of have to work out, what kind of terms we want to use there. But yeah, no, it's really interesting.
Great, thank you. And then there's another comment. I would like to, I'm not sure how to pronounce Kaushalaya. Thanks for the engaging talk. I would like to know if the diary talks about intimacy in the context of shame.
Could I press for a size expansion, or what you mean by intimacy? Is this sexual intimacy or? Yes, okay. Not that I've found so far. As I showed at the start, she does rather kind of cross out quite a lot and very enthusiastically. So one of the things I quite like to do as I kind of work on this for an edition is to, I'm told that the British Library has some technology where they can try and tease apart the inks, so you can sort of work out what's written underneath. So, hopefully she's written all sorts of juicy things in those sections, but otherwise, no, it's a very non-sexually explicit diary. Yeah.
Yeah, I was going to ask you that, if it was possible to decipher what was under the squiggles. Is it not possible to see? Sometimes
she crosses out more simply, and that's it. But no, if she's really scribbling it, she's really scribbling it.
Right. Yeah. Interesting. And
then you've got and that's sort of a whole extra level too. It's also like a retrospective editing, and if we want to put shame on that, where as opposed to the sections that she's writing in code, it's a very basic code. She's literally just writing backwards. but that's kind of a decision she's taking at that time, that, oh, this feels a little bit risque. I'm not going to write it out nice and clearly for this one. Whereas the scribbling is sort of a later, like, oh no, I don't, that's a bit embarrassing, Gertrude, cross that out.
Thank you. Are there any other questions in the room? Does anyone, or you can add to the chat, any other questions or comments? No? I might take that as a no. Emily, is there anything else you'd like to add? Otherwise, we can close our seminar early if there aren't any other questions.
No, I just thank you for your questions. I've got some areas to think about now.
Yeah, thank you for your talk. It was super, like, I'm not a historian, so it was like really interesting to get this, like you said, a micro history of this particular individual and get into the imagining of what life would have been like in this kind of encounter. So it's really rich and interesting account. So I really appreciated that. And thank you for speaking in our seminar series. It's really nice to have you.
Thank you.
You again. And there'll be a recording of this talk. So if you have a colleague or a friend or anyone who would like to have heard it but wasn't able to come today, we will have this on our website in the next week or two, and it's free to share with anyone who's interested. So thanks everyone for coming, and have a lovely afternoon. Thank you.